you all for coming back. You know, to invite me here. And I'm gonna stick to my guidelines and try to follow the steps. So I'm Marsha Brookins. I am the director of DGM. I just joined Indian Health Service April 2022. Came, got this wonderful staff. I hired a couple of new people, and I'm excited about some of the opportunities for us to make some really good change at the Indian Health Service with grants. We have a total of 13 staff members now in our division, and that's nearly not enough. We oversee $300 million in grant awards. We have right now about over 500 grant recipients in our system. And some of the things that we are working on and the things that we have changed since April 22, we now have a policy team. We are really focusing on getting policy alerts out, policy memos out. Jami is the head of our policy team. We have a training team. If you are not getting all of that training that we're sending out from our partners, please let us know. We have sent out we've had at least 7 trainings offered from Grant Solutions, and we're going to work with payment management systems to get more training out. You really want to get training out, and we're also developing some in-house training. I want to thank, because I jumped around a little bit, I want to thank Dr. Johnson, who was here at the last session from the area office, and also Ms. Arnold Miller and Dietrich for having us here. And I want to announce to you, if you have conferences or you want us to come out, please just contact me or the GMS that's assigned to you, and we will try to come out. Our director wants to see us go out more, so we do have travel funds. Okay, and now I'm going to get to our agenda. Where are you guys located? We are Rockville, Maryland, but most of them. And most people say DC, but we're not actually in DC, but it's not that far. Okay, next slide. Okay, so this is what we're going to cover. I've already done I'll let each staff person introduce themselves. I have a really great team. I can't say that enough. And I'm just going to say they've done an amazing job. I want to let you know that. I know for some pushing people, I like to stretch people. And I know for some, they don't like to do public speaking, but I told the entire staff, we are going out, we're going to do it. And you guys will be well received, and we will give us feedback. Okay, we're going to cover this, and we're going to go through it quickly, but we want to make sure that we answer all of your questions. So don't worry about interrupting us. Just raise your hand and we'll address your question. Effective grants management, I'm talking a little bit about that, and then we're going to go through each of these areas and give you some important information so that you can take back to your recipients or your staff. Next slide. Next slide. Okay, so this is the grant cycle. I'm sure you've seen this 1,000 places. This is a big. Okay, so the first part of pre-award is the application process. And I think we got a question last session about, when do I know when an application is out? When do you guys announce it? Well, we don't announce it within DGM. That is all of the offices within IHS. And there are, 15, 20 different offices offering about 30 different grants. So if you ever want to know what funding opportunity is available, you want to go to any of those grant offices, the web pages, our website. We always post them, DGM at IHS.gov, or you can go to grants.gov. Grants.gov has every one of these grants all across the federal government. But if you put in Indian Service grants, it will list all of the available funding opportunities there. Now, our role as DGM, not only do we manage all of the grants for IHS, we actually help them write them, and usher them through the process. So at any given time, we're doing that. And I had a list, a tracker, I have someone on staff who tracks all of that for me. I can tell you where each of them are and what phases. Like we have some grants right now that are being, some NOFOs, notice of funding opportunities, being written. We have some that are being cleared. We have some with OMB, Office of Management Budget, because they actually have to review ours. We have some that are right now in a technical review, and we have some about to be published. Well, wherever they are, they will always come through our office, and you can always find them on our website. That's just some of the things we do. And then the next thing is, once it's announced, if you are an organization or individual, depending on what you're able to apply for, once you apply for it, you go through a technical review. That's where you get the application scored, reviewed, and awarded. Once it's awarded, you get a grants management specialist assigned to you in the system. That person is going to walk with you and be with you the entire time of your grant, whether it's 2 years, 3 years, 4 years, and 5 years. In fact, you not only get one person from my staff, but you also get a person from the program office. So you have 2 people at all times that's with you. One thing I like to point out is that a grant there's a beginning and an ending. It's called a period of performance. Period of performance. So if the grant is 5 years, it starts and it ends in 5 years. And then there's another cycle. So there is no carryover between cycles of period of performances. There's only carryover between year 1, 2, 3, 4, 5, and it's a 5-year grant. So that's one thing I like to point out, because a lot of people say, oh, we didn't get to carry over any money from FY16 to the new award. Well, there is no carryover. The only thing, or the only reason you were allowed to keep spending money is if you were approved for a no extended. So I just like to point out very generic terms, because sometimes it gets confusing when people are asking questions. So just keep that in mind. Within each period of performance, there's a lot of activity that happens. You can ask for a change in scope, you can change personnel, you can talk to your GMS and your PMS about, hey, something's not going right, I need to change my scope, I need to change some funding. If it's over 25%, you call your GMS, you call your program staff, and they will approve it. If it's under, you can do it automatically. But those are things that happen as they manage the grant with you. Now, one important part, and Denise is going to talk a little bit more about it. After you get through all of the managing process, it's the closeout. And I like to emphasize this because we were in hot water because HHS, the deputy secretary, called all of the grants directors together and says, hey, what is going on with your numbers? And I was over at IHS, so she said, tell me, Marsha, what are you going to do to get those numbers down? We were so high we had all these open grants for years. Now that's a bad thing, because grants are supposed to be closed out. Unfortunately, and we weren't the only ones. Yeah. CDC and NIH were terrible too, but IHS was really high. We had so many grants that were open, particularly SCPI grants. And you may say, well, we were supposed to keep them up, but no, we weren't. They were only supposed to be 5 years. But all these things happened, and then COVID happened, right? And then they gave us some extensions. So just keep in mind, this is what I want you, when you go back and talk to staff and they say, well, we can keep a grant up over 5 or 10 years. Say, well, that's not right. Marsha Brookins said, grants have to be closed out afterwards. So again, and we're emphasizing that because we did have 762, I said the wrong number. 732. 732 grant open, and this was May. I met with the deputy secretary and the director, so we met with her, and she said, close them out, let us know how you're doing, and keep them closed. And we did it, thanks to Denise, who was the lead. We went down from 732 to 2, and the only reason we have 2 open is because we worked with, it was a grant between another operations division in IHS. So we're working on that. Now, the thing is, we want to keep those grant closeout numbers low, and the only way they will rise is if SCPI does not close out the grants. Y'all hear me? If And you see what they're closing out now? Well, some folks got, I think we had the number, 302 SCPI grantees, 171 of them got no cost extensions, which means that these grants are now being closed. What does that mean? Closed means the recipient must submit the 425, the property and all those pieces. Jamie's gonna talk about that. And if they do not, that grant will stay open and our numbers will go back up again. And this time, and she has said this on the call, she's gonna call in all of the heads of the offices when the numbers go back up, which means the director so will be called in a meeting and then she'll say, Marsha, why are those numbers going out? So again, we emphasize closeout. So that is the entire cycle in a nutshell. Next slide. Okay, you're up. Yeah.
So let's start at the very basic beginning of this process. Indian Health Service, we have two types of grants. Two types of awards, grants and cooperative agreements. The biggest distinction between these is that cooperative agreements have a lot more involvement from the federal agency, whereas grants do not. Next slide, please. When you receive your grant, you will get what is called a notice of award, an NOA. We often call it a NOA. The NOA will outline all of your obligations and expectations as it pertains to the grant. It is your guiding documentation. It will be sent automatically to the key personnel listed in your grant, which is your program director and your authorizing representative. Next slide, please. This is what your notice of award looks like. And as I said in the last month, I'm sorry, my technological abilities weren't able to make that bigger. It's very hard to read. It does contain all of your important information. So line 1 contains the recipient's name. Line 7 and 8 are your key personnel, your project director, your authorized official. Those are actually who goes into Grant Solutions and who will get all of the emails and communications that come from Grant Solutions. Line 9 is the awarding agency contact, which is your grants management specialist like myself or Donald or one of our colleagues. Line 10 is going to be your program official. That will be the person who answers any and all of your programmatic questions. In the middle, line 19 is your budget period start and end date. That is typically a year. For my SAFTA grant, it is April 1st to March 31st of the following year. Line 25 is your total funding that was approved. 26 is your period of performance. That's the entirety of the grant. So for the SAFTA program, that's 5 years. It's often called project period as well, a period of performance. Line 30 is remarks. The remarks section is going to have things like you have a restriction on your award. You need to work with program within the first 3 months of year 2 to refine your goals. Things like that will be in your remarks section. Next slide, please. On page 2, you're going to have your detailed approved budget in line 33 in that section. Some recipient agencies won't let you your finance department won't let you draw down funds if this section does not match what you outlined in your proposal, which is going to delay you being able to provide payment to your vendors. If for some reason they don't match, contact your GMS. We can do a revision and we can correct that for you. But make sure you review it as well to make sure it's correct. Next slide, please. The third page of your notice of award is going to have all of your, it's called award attachments. It's going to be all of your, all of your terms and conditions. It's going to have your programmatic terms and conditions, your general terms and conditions, your reporting deadlines and requirements, items like that. Next slide, please. The next 3 slides detail what I just talked about. So when you guys get a copy of the slides, you won't have to try and rely on my little teeny tiny graphic. You'll actually see what it says. Next slide, please. Next slide, please. As I mentioned, you will have, you may have restrictions listed on your award. It's not a given. If there's nothing that needs to be changed and everything is there, you're fine. The most common restrictions that we see are for things like you have an expired indirect cost rate agreement. So your indirect costs will be restricted. You won't be able to draw those down until you provide an updated agreement. Perhaps you have items in your budget that aren't allowed, like food or entertainment. They will restrict those funds until you make that revision to your budget. The last one that we see a lot of is delinquent financial audit reports. You are required to have a financial audit report, and if you don't, that will be a reason that your funds are restricted as well. Next slide, please. Programmatic terms and conditions are what you need to complete in the program side of the grant. Special requirements such as you must work with X amount of community organizations to fulfill certain program goals. Perhaps you need to attend conferences or provide professional development. We'll have any deadlines for submission of your programmatic reports, whether they be annual, quarterly, and then any other requirements which will be noted in the remarks section. Next slide, please. Thanks so much. I was like, why is this here? Your standard terms and conditions are going to be things like 2 CFR statutes, any of what we would term like the legalese of what you're required to do based on the uniform financial requirements. Always make sure you review these so that you can make sure you're in compliance and you don't have any issues. Next slide, please. Financial requirements and deadlines. The main financial requirements and deadlines you're going to have with your GMS are going to be for your federal financial report, which is also an SF 425 or an FFR. You're going to have to do these annually, which is the end of your budget performance period, and they are due 90 days after the close of the budget period. At the end of your performance period, so you're, in my case, a 5-year grant cycle, you have to do your final FFR, and those are due 120 days after the end of the project period. You will find these reports in the payment management system. Next slide, please. Everyone who has a financial, who receives a federal award, uses PMS with us in order to access their funds, to get their funds to pay their vendors. You should have internal controls to make sure that your staff are utilizing it appropriately. And you will work directly with PMS to establish an account. They are one of our federal partners, but we do not actually, they don't work for us, so to speak. Then we have listed their contact information there if you should need to get in touch with them. Next slide, please. PMS would also be the person people to contact if you need training on that system. They provide great training. I've actually taken training from them. They're very thorough and they provide wonderful reference materials. Any requests for training, you can reach out to them at the number or the email on the previous slide, and they will be able to assist you with that. Next slide, please. Programmatic requirements and deadlines. As I mentioned, these are going to be your progress reports. How often you have to complete them is part of your programmatic terms and conditions. Many of our programs have a data portal, which is where they put all of their programmatic reports. When you upload a programmatic report, or excuse me, not upload, complete your programmatic report in the portal, you would need to include a copy of that as a grant note in Grant Solutions once that's been completed. If you don't complete these, they can delay your funds. They can deny you future funding. So make sure you get those done in a timely manner. Next slide, please. Single audit requirements are required of non-federal entities that spend more than $750,000 in a fiscal year. They're due to the Federal Audit Clearinghouse, which we call FAC, either 30 days after the completion of your audit, or I think it's 9 months after the fiscal year ends, whichever of those dates is earlier. This is going to, if you don't have an updated single audit report, the entirety of your award can be restricted. And it will not be unrestricted until you resolve that or look at your GMS and have a plan before you can resolve that.
Can I say one thing, just to add to Jamie's point? There's a lot of emphasis right now at the agency level, HHS. I'm getting a lot of guidance from HHS headquarters about audit compliance. And we are working with our division of audit on that. Now, that is something that hasn't been enforced a lot across the agency. But let me just tell you that we do have the authority, if audit compliance are not met, to restrict the funds. So for example, right now, SDPI has awarded F23, and we have sent repeated reminders, okay, get your audit, get your audit. We have the authority to restrict all funds, meaning just stop everything. We don't want to do that. That would be bad, right, for the people we serve. However, there is a lot of pressure coming. So we really need your help, and particularly the federal staff and the area offices to help us with that, because we're getting a lot of pressure about audits. And it's
And audits are how we make sure that everyone is expending their funds appropriately. Not that we think anyone, we're not trying to have an I got you moment. We want to make sure that we're in compliance just as much as you're in compliance. We want your communities to get what they are supposed to be receiving. So it's in everyone's best interest. Next slide, please. We're also, now that we're past the management portion, post-award changes are any changes you make to your award after it's been awarded. There are a number of changes you can request, but they need to have prior approval before you actually make the changes. They're changed in your approved scope. Wow, there are changes in your approved scope of work. Changing your key personnel, which is your authorized representative or your project director. No cost extensions. Carryover requests in excess of 25% of your budget. That is a key term, excess. If it's under 25%, you do not need prior approval. And then budget modifications to 25% or more also require prior approval. Next slide, please. Change in scope. I put in these the instructions on how you would need to submit that request in Grant Solutions as an amendment, and the items that you would need to do that. We also have, as Marsha mentioned, a policy alert on our web page, specifically called Change in Scope Request. That will direct you exactly how to do the process, as well as the items that you would need to do so. Next slide, please. Changing key personnel. One of the things that happens if you have turnover on your key personnel routinely is you're going to miss out on receiving information. It's going to delay your project, has potential to really impact things in a negative way. So you want to make sure that if you have a change in your PD, you have a change in your AO, that you make that request. And again, it's something you can do in Grant Solutions. Super easy. There's only only 3 items you need, but the others aren't always. So you may need, if applicable, we will find the instructions. So next slide, please. No cost extensions, as Marsha mentioned, are for when your project is coming to an end and you have not achieved all of the goals you need to achieve and you need more time. So you would apply for a no cost extension. You can apply for up to 12 months. You may not get granted 12 months, but you can ask for up to 12 months. And again, all of the items you would need to do that are there. We also have a policy alert on this particular topic on our website too. It details all of the information. Next slide, please. Unobligated balances, often called carryover requests. This is what happens from budget year to budget year. you're in year one of your grant, and for whatever reason, you weren't able to spend all of your funds. A common reason for that, just coming out of COVID, is lack of ability to hire someone. So you have a large amount of funds you need to spend because you've now hired them. This is when you would request a carryover request. You, again, it's something you do in Grant Solutions. We also have a policy alert on that, which includes all of the information you need. The most important thing to remember, don't proceed spending those monies until you know you're approved. Because there is sometimes some back and forth on the budget items, and we don't want you to spend money that you may have to return beforehand. How will you know if it's been approved? You'll get a revised notice of award, and that will tell you what it's been completed. Next slide, please. That's the instructions. Retail instructions. Next slide, please. And now I'm doing it. It's Denise's turn.
So spending the funds sounds easy, but it's not always easy. What we ask is that when you draw down funds in payment management systems, it should be the exact amount that's necessary to pay your invoices. We want to make sure you are paying your invoices quickly. And I also want to mention that we have a lot of recipients that are not drawing down their funds appropriately. So what we're finding out is that there's a lot of unobligated balances, which could cause problems when we go to close out the awards. It's important that we adhere to the proposal that you submitted and that you're drawing down your funds and implementing your work plans. We don't like to have, well, carryover, as Jami has mentioned, is done between budget period and budget period. But if your carryover is very large, you may offset your account. Offsetting your account means you won't get new money for your future years, like year 2 or year 3. You'll just be able to use the money that you didn't spend in year 1 for that budget period, year 2. The other problem with this is that when we get to the final year and you still have a large unobligated balance, the money is returned to Treasury or back to IHS. This does not look good for our agency, especially because we know there's a need for the monies to be in the communities. So we don't want to show Congress that we're not spending these dollars. It's very important that we spend the dollars, adhere to the plans that we propose, and do the work. Next slide, please. So closeout, what is closeout? Well, closeout refers to the end of the grant's life cycle or period of performance. And every grant is going to experience closeout. Marsha has mentioned that our agency was under, I guess we were defiant with not closing out grants properly. Closeouts has to happen within the 5-year competitive segment, although we do have some grants that are 3 years. So at the end of the grant, the recipients have 120 days to submit all of their final documents and close out their grant. And we as IHS, we have 180 days to verify that we received everything and close out the grant. So closeouts, again, we got our backlog from 732 to 2, which was very good. However, this is it's a rolling ball. It's going to continue. We have new grants that are happening right now, and this 5-year period starts again. So closeout is always going to be happening. And the grants management specialists are monitoring their portfolio and closing out their grants accordingly. So it's very important that we pay attention to closeouts, and we'll notify you. Next slide, please. Speaking of notification, this is how we notify you. The last year award, so if you have a 5-year award in the 5th year, we will put a footnote in your terms and conditions. It's called the final year footnote. It'll say something like, this is your final year Recipients are required to submit their final progress report, final financial status, it's no longer financial status report, it's a FFR. And all other applicable forms. It will be a note on your notice of award. We're also going to send a closeout letter 30 days prior to closeout. And we're going to also notify you in Grant Solutions as a bulk note. So it's important to whoever is managing your Grant Solutions, they pay attention to the notifications that are coming through. Next slide, please. Okay, DGM's responsibility. It's our responsibility to provide guidance to you on all of the closeout requirements. We're going to make sure that you're compliant with the terms and conditions. We want to make sure we receive documents timely and accurately, and we're going to completely close out the award. The next slide, please. Now, the program works closely with your organization to make sure that they are receiving the programmatic report that they need. And the programmatic report has to cover the entire competitive segment. They let us know that they received it because a lot of the program officers has to report to Congress. So they utilize that information for their report. They make sure they let us know that they received an approvable report, and then we can move forward with closing out the grant. Next slide, please. What to submit? So the three main items is the FFR, which is the final federal financial report, the PPR, which is the final program progress report, and the SF 428, which is the final tangible personal property report. Now, the progress report, it has to be submitted in grant notes. Some of the programs has their own portal where you can submit your final progress report. However, since our official record, system of record is Grant Solutions, it will need to be submitted in Grant Solutions as a grant note. The FFR is through payment management systems. Next slide, please. This is just a sample of the reports, the final progress. The first one is from the diabetes program. Your final progress report may not look like that. It may just be a Word document, but that is a sample from BBTP. The FFR, which is also the SF 425, looks like the one in the middle. And this is the report that we normally have to return because it's not accurate. It has to reconcile with payment management systems. It cannot have any unliquidated obligations, and the unobligated balance must match exactly to what payment management system has in the system. And this final report here, number 3, is the equipment and supply report. And we need the 428B and C if you want to dispose of the equipment. Next slide, please. Okay, so this is the final progress report. And again, it must cover the entire programmatic segment, the entire competitive segment. And it should list a summary of the progress that achievements toward your activities, a list of significant results, both positive and negative, and an evaluation on the accomplishments toward the goals and objectives for the entire period. Next slide, please. Okay, the financial reconciliation, this is the FFR, and this form must reconcile with payment management systems. Very important. It should be marked final, no unliquidated obligations, and the unobligated balance must match what payment management systems have, because that is the money that we need to deobligate. Next slide, please. Okay, the SF 428, which is the final tangible personal property report. This is for you to tell us if you have any equipment or unused, unopened supplies that has a fair market value of $5,000 or more. This needs to be listed on the 428B. Now, your organization can continue to use the equipment and supplies for your project. As long as you need, it can be used for another IHS program, or another HHS program, or another program that is for the community. But you need to let us know where you're using the product, the equipment for. There's a section in the 428 where you can list, if we're going to continue using this project, the equipment that's greater than $5,000 for a diabetes program or a tribal management program, whatever it is. When the equipment is no longer needed, there's a section, SF 428C, which may be on the next slide.
Next slide.
Yes, this is the disposition. So on the 428C, if you no longer need the equipment, you can fill out this form, send it to us, and we will tell you how to dispose of the equipment. Now, again, this is for any item that has a fair market value of $5,000. So if you're in say you started in year 1 and you had a computer that was, I don't know, say $7,000. By the time you get to year 5, the fair market value for that computer is no longer going to be $5,000. It will be less, so you wouldn't need to report that out. Also, if you have, say you have some, I don't know, treadmills, say you have 5 treadmills and they were $1,000 a piece, that would not need to be reported also, because one item of equipment that needs to be 5,000 and more needs to be reported. Also, if you have items that are less than $5,000, it may be retained, sold, or otherwise disposed of with no further obligation to IHS. However, I'm going to check on how that works for our federal recipients. Next slide, please. Okay, now this is just letting you know that we need to retain our records for a minimum of 3 years. And it may be longer if there are any type of audits or litigations. We ask that you keep your records as long as necessary until it is all resolved. And the next slide, please. Oh, Marsha, we're back to Marsha. I went too fast that time. Thank you all for listening.
Putting out fires, you do.
On policy.
Okay, so I'll be very quick and then I'll open it up to you guys, ask questions. So, like I said, we have a couple of teams now in place and we have a lot of information that we're sending out to you. And policy alerts, so if you're not getting any of these, please let us know, because we're sending a lot of information out, so I don't want to ever hear someone say, because we have it posted on our website, and we're also sending it out to the federal staff. So please let us know if you're not getting it. Also, if you want to see a policy alert, maybe you're getting a lot of questions and you want to really understand something, send us a suggestion for a policy alert and we'll get it done. Like I said, Jami is our lead on the policy team, but we also have a training team, Jillian, who is not here. I was just emailing her. If you want a training that we're not currently offering, please send us an email. You can use it at the general mailbox. Let us know. And again, I want to make myself available as well. If you ever want to just reach out to me and let us know how we're doing, please give feedback on all the GMS. If you have some concerns, just want the director to know, feel free, email me. I do like emails and I do respond. Next slide. Helpful resources. We as the administrative team, federal side, we always look to our policy. Our policies are our circulars, 2 CFR, all those long numbers. That's what we look to for our interpretation. We also look at the HHS grant policy statement. So we always refer back to that. And I also ask all of the GMS, whenever they're responding to recipients, to include those links so that you can go there and directly look at that. But if you're ever unsure or you're getting conflicting guidance, send us an email for clarification. We get a lot of questions about purchasing of food. Now, some particular grants do allow for that. Car vehicle purchases, there's all kind of, little rules and little things you have to be very careful when you're purchasing large equipment items and things like that. So just feel free to reach out, but these are the references that we use. We always make reference to the policy that we're citing to you. And then, next slide. Who can help me? Always, always, always start with your program staff and GMS staff. And by that, I say send the question to both of them. One person is a specialist about the program, like diabetes or opioid. They're nurses, they're clinical folks. They can answer what we want you to do with that particular grant. However, we are the administrative side. The money, is it an allowable cost? The 425, how to submit the reports, grant solutions, that's us. So just, I always say send a question to both, that way you don't get misinformation. Because these two are supposed to be talking, and I'm gonna be transparent, it doesn't always happen. So if you email your program staff and they tell you, oh, yeah, sure, you can purchase that. And then the GMS, like Donald or Jami, sees something that is totally not an allowable cost. It's a conflict, right? So I always say, send your question to both. We have a general mailbox now that's monitored all the time, dgm@ihs.gov. Let's just say like Donald's here. We do have other staff that can address it, but you can send a question there. I even look at that box. So feel free to use all of the resources. Grant solutions. Now keep in mind, we are the federal staff for the grant administrative side, but we have 2 federal partners. Grant solutions is not us. We don't manage that system. We work with them, we meet with them weekly. We don't manage that system. There's a lot of issues that I have sometimes with systems. Sometimes systems don't always talk, right? Grant Solutions is not talking to PMS, and I've been yelling about it. We have a lot of problems between the 2 systems, but they are our federal partners, and we will reach out for you. However, we tell you to go directly there, so there's a ticket and there's traffic and there's documentation that you went there, and we'll follow up. If it becomes elevated, you need to elevate it to your leadership, we will get involved. But we always say start with their support emails first. Next slide. This is all of our staff. Is John on there? Yeah, he's getting his email. It's up to date. But this is all of our staff right now. We're 13 strong. You don't know how hard. There's massive stuff going on daily. We're communicating. We have 1,300 actions in the system that we process on any given day. Yeah, but this is a great mighty team, and I just want to applaud. Some of them hadn't done this before, but Marsha pushes and stretches people, and I stretched them out of their comfort zone, and did they do it phenomenally? And again, if you have any conferences or you want us to come out, we're definitely gonna be doing some site visits. Email us and we'll come out. We appreciate you. Thank you, Dietrich. Again, I think that's the last slide.
Yeah, but after that is for the next session.
Yeah. Now we have questions, but do you all have any questions or something that's burning you want to ask us? Yes.
Thank you all. I'm coming up, but I do have questions and do the other part, but I do have a couple of questions. One of the things you talked about is policy alerts, and sometimes there's a lot of different information coming from different organizations. So sometimes that information can get mixed into some other stuff. Is there a way for us to, like in the SDPI space, policy alerts as it pertains to SDPI, is there a way for us to register so in a system so that those policy alerts kind of red flag us?
We don't have a system that's based on each grant program at IHS yet. The policies that we're putting out are generally for anyone, regardless if they're SDPI or behavioral health or suicide prevention.
Gotcha.
Your program specialist, which is Carmen,
right,
and Melanie and all those folks, we meet with them every couple of weeks and we try to talk through issues. But we'll be honest, there's a lot of times there may be misinterpretation. Yeah. And then keep in mind, she has area of diabetes coordinators, she has other coordinators and things. So I always say, for policy, come to us. And then if you hear something different at the program side, let us know and send an email to both and say, hey, talk to DGM specialist or GMS specialist or Marsha, and they gave us this policy and they said we're supposed to do this. I talked to you, Carmen, and you said we're supposed to do this. It's not putting people on blast, it's
Right.
so we can clear up the confusion. Because, and we say no food. I'm so used to that in my brain, in my grants world,
Right.
because in my world of immigration and state grants and poverty grants and IU grants, you couldn't use money for food. But guess what? In some Indian tribal grants, you actually can, depending on what it is.
Right.
So there's sometimes not a blanket policy interpretation for everything.
Gotcha.
So that's why it's always good to check.
Right. And I appreciate your statement about adding the programmatic staff and grant management staff on the same email, because it's transparency and it gets you to a right answer.
Yes.
The other thing that came up that I was thinking about is, just like you have staff turnovers on the tribal nation side, you also have staff turnover on, grants management and programmatic management side as well. Like right now, you had 13 and one more. How do we keep up with that? Because a lot of times we'll get, changes in, say, grant management specialists. How do we keep up with that if you're on grants?
Very good question. And I just sent out, hopefully, I sent it to, so this would have went to all of the managers, area office directors, all of the program staff, and federal staff. Whenever there's a change in a GMS or assignment, because each of them are assigned an area.
Right.
We just got John Hoffman, who just joined us to speak, who's previously here, but he came back. He had to get a portfolio, so I had to take some programs from other people and give it to him.
Right.
So now he's the new GMS, but I sent it out, but it's always posted on our website, DGM website. Let that be like a go-to for you. And again, we're enhancing it, making it better, but it's there.
Gotcha.
With the new assignments.
And,
Yes.
and to chime in, the grants management specialist will also send out an email notification to the authorized representative and the project director that's listed with notice of board, letting them know that there was a change. And there's also a note that's going to be provided within the grant solutions.
Right.
Thank you. Yes,
I always
cover all of our bases.
that thing about the grant note, it'll pop up in your email. It's like, hey, a new grant note has been added. So we do get those as well.
Yeah.
And don't turn off your notifications. I know it's a pain to get a lot of notices, but sometimes you're getting really important information that gets lost if you're not checking it.
Right.
Trust me, I get 3,000 emails every 5 minutes.
Oh, wow. So to that point is my next question. Is there a way to add another person to get that grant note or to get that information as well in the system, so that and I know there is, but I just want to ask this question for others in the room.
Excellent.
But like, if I'm at a conference like you all are today, is there another person who's getting that information so that we can get it and respond appropriately?
Very good question. There is no limit. We checked on this a lot. There is no limit. However, there's different levels of assignment within grant solutions.
Gotcha.
So. why am I answering this
Well,
question?
we're right. So that should be directed to grant solutions itself. Like there's a grant solution user account form that you just have to fill out.
Yeah.
And on that particular form, you can have the individual listed as key personnel,
Okay.
project director, financial management, but it will be a particular assignment that individual can be listed at, and they can also receive those notifications. But that should be directed to the grant solutions help desk.
Right, but I think just to add to his point, like, if he wants 4 or 5 people, they may not have a role, he just wants them to get those notices, and that is correct, they just won't have a primary role in there, but they should get notices of what things.
Yeah.
So yes, and you should all check and see if you're not the primary, and I'm talking to all recipients right now, right?
Pretty much, yes.
Recipients.
In some form of grant, I would imagine. So, yeah.
So, yes, you should, whoever is your primary person, they should be sharing, but I have seen personally, because people will call and they'll say, well, John Black, he got it. And I said, well, we didn't get it. Well, he's your person, why isn't he sharing it?
Right. And or sometimes John Black don't even work for the tribal nation and or the organization anymore, and he's getting all the alerts, and then it's last minute, 3 days before something is due, and somehow, some way, the information you put, I was like, hey, is this something that we're supposed to be doing? It's like, yes, but that person's not here anymore. So we can add people to it. A central person that's not, they can get the information to put out the situation.
And to that question or that point, if they're no longer there, the grant solutions, if that email is deactivated, it will send a bounce back. And so the GMS will know that it's bounced back and they will reach out. But I would say it should be multiple people, it should never be one person in the system. There's too much information. Keep in mind, grant solution is the actual record, the federal record that we utilize.
Gotcha.
And we do a lot of stuff by email.
Right.
But they know, I don't want it just an email, it has to be in that system.
Gotcha.
So make sure that that person is the right person. And make sure that they are sharing information. That's so key.
And to second that, it's always good to have those individuals listed under the project assignment, because a lot of people call and they want to inquire about the grant, and we cannot relay information unless they are like key officials or, the authorized representative or project director, and they would have to get authority to speak on their behalf of the actual key contacts on this. So like, people may call and want to know how much money is listed in personnel.
Right.
We cannot provide that information because it's only listed to those individuals that's only the notice of reward.
Right.
So that's definitely key.
It's good stuff. Good stuff. All right. Other questions? We got a little time left now. Other questions? All right.
Can I ask, can I ask a couple
Sure,
questions?
sure.
Let me ask you what, as recipients are some of the needs and what are some of the areas where you have the most questions about when it comes to grants or with TGM or the IHS? Anything? Areas that make you want.
I have questions. We want our. And with